Well, hey everyone, we're super excited here. I've got Holly as our guest today, and we are talking about bioidentical hormones and even some histamine intolerance. Now, I asked Holly specifically to talk about the histamine intolerance, not knowing that she actually has experienced a lot of this stuff for herself. I had no idea. So she's actually the perfect person to come and talk to us because that particular issue is really kind of slippery and it's hard to understand. So Holly's a great lecturer and she's a wonderful speaker, and we're just so excited. I'm really excited to see what you put together, and I'm ready to learn. So I'll be putting myself on mute and you can just take it away.
Awesome. All right. So I decided to go with a little bit of pink because it's kind of my color. It's my jam. I love it. Brighten things up a little bit in the world of histamine. So, a little bit about me and a background about me is I have been in the integrative health space for over 20 years, master's of clinical nutrition, as well as a medical background. I sort of went from the medical side of things when I realized it was failing to the herbal side of things and the more functional medicine side of things and realized, okay, that's missing some stuff. And then I came back and I now sit comfortably in the middle where I love science and I love woo. And that's where I found results for myself as someone who has MCAS, which is mast cell activation syndrome, which is the ultimate histamine arsehole. So I am someone who is trained in bioidentical hormone replacement therapy over 15 years in clinical practice, seeing patients in the perimenopause and menopause space. I have come across so many women who have said, I can't have hormones because I have histamine issues. They come on board, they say, I can't have hormones because I have migraines, and they're cyclical migraines. And I say, that's a histamine issue. We can fix that. However, how we fix it to allow you to be able to have, to utilize, if you so choose, hormone therapy is the most important part of the conversation. So let's get into it. We know what histamine is. Most of us, we think I go outside, there's a plant, I smell it, I sneeze. There's a dog, oh no, I cough, I sneeze. It's going to be hives, rashes, itchy eyes, watery nose, gastrointestinal symptoms. Sometimes it is loose stool. Sometimes it's constipation. It is all sorts of different systems within the body that gets hit with histamine. And as our hormones fluctuate, so does our response. How much histamine we're producing, what our body is doing to counteract the excess histamine. Are we making more of it? Are we stopping it? Are we pushing it down? Are we getting rid of it? Are we producing what's needed to adapt to the histamine? So we know what histamine is. If you suffer from it, you know what it is. If you don't suffer from it, you are lucky. So, what does it do? If we don't have enough, we're sluggish, we drag. We've got other things going on in the background. We feel not lethargic, but very sluggish. If we have too much of it, it's chaos. So I like to call it the Goldilocks zone. If you look at the slide here, it talks a little bit about hormone modulation, talks about how it fluctuates with estrogen, how that's going to impact us during, perimenopause, when we have PMS, all of that, and because of the fluctuating hormones. So maybe your histamine issues weren't as bad when you were younger and we hadn't completely destroyed our digestion, when we could eat anything we wanted to and drink all the alcohol and there was no problem. And then we got older and we don't recover the same from alcohol and we can't eat the same foods we could eat when we were 20 because our body doesn't react the same way. Our hormones are also doing different things. We have this flushing, temperature change, this vasodilation, we go, oh my God, I'm getting hot flashes. But sometimes it's histamine, not hormones, even though hormones are playing a role, right? We've got, our neurotransmitters, there's an influence there. So whether it's headaches, fatigue, hot flashes, um, that focus where we just can't seem to really hone in on something, and anxiety, histamine and anxiety go hand in hand. It is huge. And something else that goes hand in hand with histamines, and anxiety is progesterone. We all know progesterone is the ultimate calm, chill you out. It's fantastic. It's working on the histamine as well. So, hormones play into this because estrogen and histamine, it's this two-way street. When your estrogen goes up, it's high, your histamine goes up. The DAO enzyme that we have is an enzyme that is in our gut, diamine oxidase. It is what degrades histamine in the gut. It is my absolute favorite enzyme on the planet. I do not leave home without it. I travel with it. It goes everywhere as a spoonie, as they call us, as someone with mast cell activation syndrome. I have to have it with me at all times because I can grab it quick, take it. If I know I'm going to eat somewhere where I might react to something, I have it on hand. If there's going to be an animal around that I'm going to be allergic to, I have it on hand. It is an absolutely incredible enzyme for anyone with histamine issues. So we know that estrogen increases histamine. You're going to get histamine release from our mast cells. Histamine stimulates more estrogen release. More estrogen decreases the diamine oxidase, which then more histamine, more estrogen, more histamine, more estrogen. You see this beautiful feedback loop we have going on here? It's like this little dance, right? But if we have adequate amounts of progesterone, it's going to do the opposite. Calms down those mast cells. It supports DAO activity and helps degrade the histamine in the gut. So when we have our estrogen being really high and dominating and the progesterone levels drop, we get a histamine overload. And when does this most commonly happen? Perimenopause. Because in perimenopause, our progesterone is going to drop. It's the first one to go. But our estradiol does this wonderfully fun thing where it spikes and then drops and then spikes and then drops. So you might have had this normal estradiol level that was maybe 2, 3, 4, 500, and then all of a sudden it's 800, 900 on a Canadian lab panel. That's a lot. And your progesterone is zero point 0.2. Where'd the progesterone go? Zero point 0.2 as a reference point. Anything below 10 is a problem. So you've got no progesterone and woo, way too much estradiol. So you have this perfect storm of histamine and chaos. It's a histamine overload. So what do? We can fix the terrain, we can put back the DAO, we can do all of the right things, but what is the biggest thing that's going to help us? Putting back the progesterone. I can't hear you. You're muted still.
I'm just laughing because yeah, that's what happened for me.
Right?
100%. That's exactly what happened for me. So
And
I'm loving it.
that's all of us. I mean, listen, even if you don't have histamine issues, we all know that what once was fine, a glass of wine is now not. Takes us days to recover. We feel horrible the
Mhm.
next day. How come all of a sudden now I have a glass of wine and my nose is stuffy and my eyes are watering and my bones ache and I feel like I have the flu from a glass of wine? Or how many times have either you or a friend said, I just don't tolerate white wine anymore or
Mhm.
red wine anymore or whichever one it
Yep.
is, they can't all of a sudden because histamine rises mid-cycle. You get the estrogen that's going to serve, or estradiol goes up in the middle of the cycle. You've got the crazy erratic estrogen that we're getting in perimenopause. We've got that low progesterone. So we have no more control of the histamine. And then we're going to give a high histamine food or an alcohol histamine
Mhm.
inducing party, right? And that's not a good time for anybody. So
No, but
progesterone
I'm
is,
so happy to hear you breaking it down like that, Holly, because when it's happening, you do start to feel like that it's crazy, right? And
yeah.
what? But yeah, I that's been my experience. Adding in the progesterone made a huge difference.
And adding in enough of it. We're so afraid to do too much. And I'm not saying, listen, I'm a fan. We've got physiological levels and then supraphysiological levels. And people will say a super physiological level like it's a bad thing. It's not. If you're having severe histamine issues, you're going to be one of those people that needs a little bit more progesterone. But it doesn't mean getting it right out the gate. Like, here's your big, here, just take all the progesterone. That's for you. We're going to just take 12 of them. Take 100 milligrams. How do you feel? How do you take another 100? Okay. How do you feel? You're doing okay. Take another 100. I have patients on 500 milligrams of progesterone. I have some patients on 800 milligrams of progesterone. The thing to realize is that what you do, how you eat, the stress in your life, if you're on a GLP-1, slowing down, gastric emptying, all of these play a role. I know this in practice, and I saw it firsthand with myself this year. I went on a GLP-1 for my autoimmune condition, very low dose. All of a sudden, I wasn't absorbing and utilizing my hormones quite so much. And then we had a death in the immediate family, and all bets were off. My mom died. Not that her passing was the stressful part, but the family stuff around it was an ongoing stressful thing, right? Wills and fighting and funerals, and Uncle Joe doesn't talk to Uncle Bob, doesn't talk to Aunt Sally, doesn't, chaos. And I happened to do my labs right around then. And one of my clinical team went, "Did you stop your hormones? What's happening?" I was taking the exact same dose. I didn't change my timing, I didn't change my formulation, and I didn't change my dose. I had progesterone of about 4. I had estradiol coming in at about 98. Anything below 100 is not good. You want to have 100 is your bare bones minimal to get bone protection. You need to have a higher level than that to get brain protection and true bone protection, and then even higher still for cardiovascular protection. So I all of a sudden realized that I'm at cardiovascular risk. My brain is about to go into self cannibalism. It's a lot. So I increased everything. I doubled my progesterone. I only added about zero point 0.5 milligrams more estradiol because I didn't need quite as much. I jacked everything up. And then the stress was gone and I could lower my dose a little bit. But the first thing to get hit when you have stress is progesterone, which is part of why you get stressed, more histamine, more flares, because the progesterone's not there to stabilize those mast cells. It's not there to reduce that histamine release. It's not, there's nothing helping you boost your DAO activity. What's breaking down the histamine? The balance that was there is gone. So we're blaming the estradiol for what the histamine did because progesterone went on vacation. So drop in progesterone, high histamine symptoms, anxiety, bloating, insomnia, hot flushes, shitting your pants. That's a fun one. I mean, listen, I wish I was joking, but don't trust a fart. If your progesterone is not on point and you have histamine issues, anyone out there listening to this who has mast cell knows it is going to hit your gastric. It's just going to be a disaster. But that's histamine. So all right, so what do we got here? I want to try and be able to read my slides, so I'm moving things around here. All right, so DAO is the enzyme that lives in the gut. That's diamine oxidase. DAO is one of those supplements that you have to get it from a clinician like myself. You can sometimes find it online, but make sure when you're buying DAO that it is the actual enzyme and not just a precursor. I do see a lot of supplements out there that make it sound as though it's DAO and then you flip it around and there's not actually any in there. Putting it back in, if you don't have enough of that enzyme, you're having histamine flares, you got to add more in to kind of help you out. Make sure you're getting a good supplement. A high polyphenol count olive oil is going to be great to help support the body to produce DAO. Now, I mean, you're not going to drink a gallon of olive oil because that's not going to be great for your intestinal tract, but having a good quality, adding it into your daily routine, taking the DAO, these are all things that will help you with histamine clearance. Anything you can do to heal your gut, making sure that you have a very healthy microbiome, that your flora is doing what it needs to do, eating the right foods, supporting it, and you're going to do a lot better. Restoring gut function, that means that you are doing everything you can do to not destroy your gut, which in perimenopause, women tend to drink more, even though we can't handle it more. We're drinking more because our give a you know what is busted. And we're trying to cope with just the mood, the frustration. We want something to chill us out. And we're not reaching for progesterone. We're reaching for a glass of red wine, which is then destroying the gut.
That's just funny. That just makes me think like, how easy it is to get some wine. Like I could just
Yeah.
get some wine right now delivered to my door if I wanted. But to get
Yes.
progesterone, I was very lucky. I had a functional medicine doctor who decided this was something we need to do pretty early in my journey. I didn't suffer for
Mhm.
too long without it, but for most women, that's not the case. So
No,
it's weird that it's easier to get the thing that temporarily maybe makes you feel better, but in the long run is working against you than it is to get the thing that actually we know for sure does help in the
it's true.
situation. It's just there you go.
We should have access. Honestly, progesterone is not dangerous in any way, shape, or form. We should have access. It should just be in a candy jar at every store. It should have batches of it in bulk at Costco. The progesterone troches that I use for myself are a game changer. Having them at my fingertip for daytime use whenever there's an issue and anxiety. I mean, I don't get anxiety, but that feeling of like just I need to drop my shoulders, that feeling, it's a beautiful thing and it doesn't make you drowsy. But again, most women think that, here's my option. This is it. This is what's out there because we're told that it's either Prometrium or the generic brand, which is PMS progesterone. Both are bioidentical, or there's compounded. And we think compounded is BS because they're just trying to make money. But I can't take this during the day. This is going to make me have a nap at my desk. So what do? You have to have it compounded into a troche that you can use during the daytime for mood dysregulation, helps with all of the feeling kind of cranky, that menopausal rage. It chills you out without making you sleepy. That's got to be compounded. So we have tools that we can use in our toolkit. If I'm cranky in the evening, I'll pop a troche. If I'm cranky in the morning, I'll pop a troche. I mean, you can't hurt yourself. My teenagers, when their progesterone drops too low 2 or 3 days before their period, they can take one. 25, 50 milligrams. It's just going to stop the cramps. The crazy psycho that some teenage girls get is because they don't have the progesterone. You just give it back. Here you go. And they feel perfectly fine again. It's such an amazing, beautiful hormone. It is no risk, no harm, no foul. And yet we have to fight to get it. So part of the health with the progesterone is restoring the gut. Supporting the hormone balance means supporting the gut, working on your absorption and utilization of your nutrients, which means hydrochloric acid in the stomach, making sure you have enough hydrochloric acid. Most of us
I
are,
was just want to jump in and say about the progesterone. I have one lady that was doing the 100s and it wasn't enough.
yeah.
And then she tried 200 and it was too much and like waking up really groggy and really out of it. So she actually went and found compounded,
Mhm,
I think it's 25 milligrams. So 125
mhm.
is the right amount. And that's where I think sometimes, you know, like we can be more cautious about compounded because it's not regulated in the same way. Like it's not exactly 100 milligrams in like the
It
pill, but
is though. If you
she's
go
having all the
to,
benefits, right? Like it depends
oh
on
my
where you,
God,
yeah, it
right?
depends
Yeah.
on where you go.
Depends on where you
Yeah,
go.
it really does. And so I was just talking to a client today about the kind of negativity around bioidenticals and saying like the industry grew out of need, right? There was the
Hmm.
demand there. And then for people like that fall kind of somewhere in the middle and needing something, it's an excellent solution. So, I'm all
Yeah.
about like if it works, right? Does it work?
Yeah.
Then it
Yeah.
works.
I mean, listen, I play around with everything. These are the PMS progesterone. I have, and they're kind of a hybrid, which is cool. They are, if you look at the monograph, which tells you what the medication does, how it does it, the pharmacokinetics of and the pharmacology, all of it. This is categorized as an IR, which is immediate release. But because of how it's formulated with an oil, sunflower oil in Canada, peanut oil in the States, it slows down how we absorb it in the GI tract. It also comes in a harder capsule, which takes longer to break down. So you're taking an IR formulation that isn't dissolving like an IR compounded, which is like, boom, done. It's getting in there. 2 to 4 hours later, we're one and done. This one is taking its sweet time. And then it's like a hybrid between the sustained release and the immediate release. It sort of sits in the middle, which some women love. It's great. But if you're finding that you're still waking up groggy, you can take it an hour sooner before bedtime. That's an easy just take it an hour ahead of time. It doesn't matter if you're a little bit groggy at 8 o'clock at night and you go to bed at 9, or you're groggy at 9, you go to bed at 10, rather than waking up groggy, take it an hour earlier, or you compound it. I mean, I have those and I have also compounded, but you can compound that full 125 together and just take one capsule rather than 15 different, and then this one, and then this one. It's compounding. If you
Yeah.
go to somewhere
She's
that's
very
regulated, it's
anxious. So
great.
she's so anxious that once she starts taking something, it's like, okay, we're not going to take that off the table. If I
Yeah,
were to,
no.
if I were to be like, let's change it all over, she's like, ah, but I mean, maybe we'll
Yes.
get there, right? We have to go. She's one that's very sensitive to just in general. I think some of us are like I am,
Yeah.
just whatever. If there's a reaction, I might have it. Not to everything, but I have to be extra careful. So,
Yeah.
I mean,
I
you
have
work with what
quite a
you
few
got.
patients who are sensitive, and their doctors are like, either you can take it or you can't. I'm like, no. If you're sensitive, start lower, titrate slower. We can. Where are we rushing to? Where's the finish line? Take your time. If you take something at a really low dose and it's working, it's not getting you to a therapeutic level, that's okay. You'll get there when you get there. Take your time. Don't feel rushed. Your zero point 0.5 milligrams of estradiol might need to be 0.25. And instead of titrating up in 30 days, you might have to titrate up every 45 days. That's okay. That's precision medicine. It's for you rather than for, well, this says this is how I'm supposed to do it. Do what works for you. And there are people who have an allergy to progesterone. There are ones that are sensitive, and the ones that are actually sensitive to progesterone can still have progesterone. But how you do it has to be fine tuned and completely different from the average bear, which is fine. But we need to, as clinicians, be willing to listen, take the time, put in the effort. And then you have all the histamine issues. And, most doctors are like, I don't know. You can't take estradiol, just go away. You can if you give your patient back the hydrochloric acid that they don't have. You can Google, there's a betaine with pepsin protocol that's online that you can find. If you're not quite sure, don't get the betaine with fenugreek because it won't work, but betaine with pepsin. And you just take one before a meal with a high amount of protein, so dinner. See what happens. Do you get a heat, a warmth, a fire? Nothing? You feel nothing? You're fine? That's a problem. You probably don't have enough stomach acid. You don't have enough hydrochloric acid. So you start following that protocol and adding them in until you notice something. You're building it back up, which is healing the gut, which is giving your body back what it needs, supporting your digestion, making sure that you've got a very healthy microbiome. You're going to support your estroblome, which is the microbiome for your estrogens, making sure you have enough DAO, setting the stage to fix everything so that you can take hormone therapy when it's appropriate, when you need it in doses that are going to work for you to prevent age related disease. So the goal is to keep you not just alive, but thriving. And gut health is so important to that. If you don't have a healthy gut, you don't have a healthy anything. So, metabolism and clearance and all of that comes into play as well, but stress, huge. We just talked about that, right? Stress is huge. Stress is one of those things that we need stress because we need cortisol. We don't need too much stress and we don't need too much cortisol. So, not enough cortisol is really bad. Too much cortisol is really bad. Chronic stress depletes the cortisol. And if your cortisol is depleted, what happens? Overactive mast cells, increased histamine release. Stress hormones and your histamine, there's another feedback loop. So, stress hormones, histamine, estradiol, histamine, like it's just, this is why we call it chaos. If you saw it, if there was imagery, it would look like someone with Crayola crayons just going like this all over the place. It's no wonder we feel like we're going nuts because our body internally is doing some pretty crazy, crazy things. So we want to make sure that we are, supporting the gut, managing stress, whatever that looks like for you. You can only do what you can do. And we all have a perceived stress versus an actual stress and how your body adapts to stress. We're all very different. So whether you're using herbs, deep breathing, meditation, yoga, Pilates, whatever your stress management looks like, make sure you're doing it. Go lay down on the floor with your butt against the wall and your feet straight up is one of the best things you can do for cortisol, for your adrenals, for stress response. You're in the shower, you sing. You can gargle water or you can sing. And the way to know if your adrenals are okay and your vagal nerve is okay and everything is functioning the way it should be is if you can sound like an opera singer. I didn't say in tune. Nobody wants to hear me singing in the shower, but I'll tell you, I go from down, down low, like all of it in the shower. I am singing Phantom of the Opera. And when I get out, I feel different because you're stimulating that vagal nerve. You're getting everything to talk to each other. So these are the things you can do that don't cost you any money. It's important. We manage our stress, we support our gut, hormones and genetics. I know you had someone talking about this the other day here on it. So I want to go back and watch that talk. I'm looking forward to it. Not everybody knows if they're a slow methylator or a fast methylator. Not everyone knows if their comp is fast or slow. Not everyone knows if there's MTHFR. I personally am one of those people who my MTHFR is fine, but further down the pathway, we have MTR and MTRR. And those for me are a bit of a mess. So that means that when I'm looking at a methylcobalamin, it's no good. I have to have an adenosyl version of B vitamins, but nobody's talking about that. And else you're watching, different geneticists over there that are popular online.
Yeah, I
So
know about this only because I had a naturopath make me do the genetic testing because she said, I think it's the vitamin B. And I was like, okay, crazy, whatever you want. And then she was right. She was
yeah,
right. I had to
yeah,
have a special supplement for my vitamin B. And yeah, anyway. So
yeah.
it's just funny, right?
It's amazing how we're so advanced, yet there's still so much that we don't know. Our comp gene is going to break down. It breaks things down, metabolites, estrogen breaks it down. We want that to happen. Slow comp, slower estrogen breakdown or, clearance, if you will, which means slower to clear the estrogen, higher the histamine load. We all know about phase one, phase two, phase three detox pathways, how we detox. So with estradiol, which is one of the estrogens, what happens endogenously within our system versus exogenous, which is interventional, what we take, is similar but not the same, which is why you can avoid some of the reactions with an oral estradiol that you might have if you took an oral estrogen or what your body would be naturally producing. So they don't all, even though it's the same compound, it's gonna skip some things along the way. So there's less of a reaction for some people, more of a reaction for others. And again, it boils down to, your MTHFR, which supports methylation. It supports those phase 1, 2, 3 detox pathways. Reduced activity means impaired histamine breakdown. It's going to affect how you metabolize those hormones, how your estradiol, what's it going to turn into? Where's it going to go? How's it going to affect you? If you're a slow methylator, it's one thing. You're going to be more sensitive to histamine. You're going to have a stronger reaction to hormone therapy. If you're a fast methylator, you might still have a reaction, but it's going to be a whoop, done, rather than a, oh my God, this is horrible. I hate it. Both can still react. It just looks a little bit different. So if you can optimize your methylation, if you know that you have methylation issues, optimize it in the way specific to your genetics, it's going to help supporting estrogen metabolism. And no matter what your genetics say, supporting those pathways is not a bad idea. Support your DAO no matter what's going on, even if you don't have severe histamine issues, supporting those pathways. They're natural pathways. We should be supporting enzyme production. We should be supporting our our proteases, the proteolytic enzymes that we have for digestion, or proteases 1, 2, and 3, supporting those. Not drinking water or anything while we eat, chewing our food, taking a deep breath, sitting with your plate in front of you with intention. We used to sit down and pray before a meal. Even if you're not religious, that sitting down and giving thanks, the sitting down, that calm, that reset from the day, going into rest and digest is huge. Your body accepts that food completely different. If you're at home preparing dinner and you're drinking carrots because you need your boss, you're not going to utilize those nutrients and digest that stew the same way you would if somebody else had made it for you. You came in and you had, oh, this is great. Oh, my grandma made my stew. I love it. You sit, you have the bowl of stew made with love and intention. All of a sudden, you're going to use that and your body's going to react to that totally different because of the mindset. So, what we do, how we do it, that all plays. It sounds a little bit hokey pokey, but it works. How many people out there watching this have sat down to a meal, you're stressed out, and either you don't have an appetite because you're so stressed. That's your body saying, I am too stressed. I'm in fight or flight. Fight, flight, freeze is not rest and digest. Your body doesn't want food. That's why you're not hungry. It's running from a tiger. It doesn't want to sit and eat. So now balancing hormones without the crazy histamine storm means doing all the things we already talked about, calming the mast cells, taking natural mast or histamine stabilizers. So progesterone is one, quercetin's another, magnesium is another, lutein, DAO enzymes. All of these are great to help calm our mast cells. And then strengthening your methylation, active folate, the type of B vitamins that you're taking, all the cofactors, those are important as well. Don't cheap out. Don't go get Kirkland brand B12. Don't go buy Walmart special Life brand. They're not good quality, and your body deserves better than that. You don't have to spend a lot. They don't have to be expensive to be good, but they do need to be good.
I
And
really agree
healing.
with you. I agree with you totally on that one. Like I've done a lot of experimenting with different supplements,
Mhm.
and I like the Jameson brand best because they're not hard to get. I can find pretty much everything I want, and it works. Like I did find four different collagens before I said, "Does Jameson make one?" And yes, they do, and it actually worked. I have fingernails, so
I don't know about the Jameson collagen, but I know that there are other supplements. We've sent them in for testing, and they test as one of the worst brands.
really,
Not
because
as
the
bad
only one that
as
works for me.
Navin. And that's okay. That's totally, listen, if it's working for you,
That's what I say too, right? If you're
that's,
trying something and it doesn't work,
yeah.
try something else because it's not
Yeah.
necessarily magnesium doesn't work.
Yeah.
It's
I
that
tell
brand for
patients,
you.
I say, do you like it? How do you find that? I had a patient
Is it
today.
working?
She said, you asked me about the zinc for my migraines. And I said, yeah, you were taking zinc, and I asked you to pay attention. Do you think it's working? Do you find? Because she'd been taking it for about 6 months. So she should have noticed something. So she said, you know what? I really paid attention. I really tuned in. And I don't think it was doing anything. So I stopped taking it because sometimes when you stop, that's when you notice, oh, it was. And she
Mm-hmm.
said, nothing changed.
Mm.
So I stopped taking it. It's not doing anything. I said, well, there you go. Now you know. Does it mean it was the zinc or does it mean it was the supplement? I don't think she needed the zinc. You don't
Yeah.
know until you
You,
try.
you don't know until you try, and
Yeah.
it's not like a, because I've had people try, like I had one of my group members say, I really like this particular supplement. I think you should try it because I was looking for a new brand,
Hmm.
and it did nothing for me,
Hmm.
but it's really working for her. So that's fine.
Yeah.
I just tried something else and I found something else that's working for me now.
Yeah.
So don't give up, ladies. Like if you need to try and
Yeah.
find something that works, keep trying.
Absolutely. I mean, and listen, I had one patient who, I pulled her off of one of those Kirkland Jameson now brand garbage supplements. I pulled her off and I said, try this one instead. And she tried it and she was like, that's too much. I went, okay, go back to the garbage supplement because your body's not absorbing and utilizing it to the full extent, which is actually good for you because you're sensitive. So take the crappy one because you're too sensitive for the really good one. And that's like that's okay. Some people like a certain thing and that's their thing and there's nothing wrong with that. I want the gold standard for my patients, but they don't have to have that if for her it's working. That's her gold standard. So it's okay. So you got to take what you take, but don't be afraid to try the more expensive ones to see, because sometimes you try it, you go, oh, that's what it's supposed to feel like. I didn't realize. You're going to know, you're going to feel it. And if you're not feeling anything after 3 to 6 months of taking something, then switch the brand or switch the dose because something's not working. All that to say, you know, get your cofactors in, get your nutrients in, do all of the things. And here's the thing, you're either going to really slowly introduce your estradiol while you're doing those things if you're having such severe symptoms that you have to start your estradiol. But if you're not there yet, you're in perimenopause, you're not at the point where you're going to supplement estradiol, my advice is put in the work now, set the stage, get everything where it needs to be, and build those beautiful habits. And then you can introduce the estradiol. You're going to get it's anti-inflammatory. It's really great for interleukin 6. Like it's great for those markers. It's going to help you when it's time, when it's indicated, and when your body is able to accept it. It's like trying to run a marathon with your shoelaces tied together. Can we untie the shoelaces first and then you can run the marathon? That's what we need to do here. So that's important to realize. Low doses, um, maintaining levels, gradually getting to a goalpost. It doesn't have to be all at once. This one is one of my favorites. I love the myths versus reality because I hear these in practice all of the time. So estrogen causes histamine intolerance. Now, it is not the cause. It won't cause it, but it is going to amplify it. So it's not causing it, but it's amplifying it. It's that circle, right? If you have an existing dysregulation, it's going to amplify that. Running didn't break my ankle, but running with a broken ankle, it's going to suck. Let the ankle heal and then you can run. Women with histamine issues are told they need to avoid hormone therapy, which is not true. Avoiding HRT makes the underlying physiology worse. It's not, you have to stabilize the mast cells, right? You have to support the methylation. So it's not about you can't take HRT, it's about slam that progesterone in there. That's what your body needs right now. Fix your gut, get your nutrients in, do all the things, then tag in the estradiol. Timing, right? Oral estradiol raises histamine, also incorrect. So this one's really fun because we talk about delivery routes all the time, and transdermal is so popular, and women don't realize what they're lacking from a patch. They're not getting that first pass effect, which we really and truly need for the hepatic kickback, that first pass effect where your liver takes it and says, let's conquer the cholesterol issues. Let's feed that brain. Let's make sure everything's functioning okay. Let's keep those bones nice and strong. I mean, you're going to get some protection with the patch for your bones, but it's not in the same way that you're going to get it from oral. But if you've got histamine issues, like what do you do? So you look at the delivery route for metabolism, you look at the histamine response, you look at that cellular sensitivity that you've got. What's your clearance looking like? Those phase 1, 2, 3 detox pathways. You have to fix yourself before you can put back the hormones. You have to put back the DAO. You have to look at the COMPS gene, look at the MTHFR, look at the genetics, look at your hydrochloric acid in your stomach. What's your bile doing? Look at all the different factors, fix all of those, and then introduce a low dose of estradiol. It doesn't need to be a lot, it doesn't need to be a high dose. Start out lower than what the lowest would normally be, titrate at a slower rate, and you might find that your perfect dose is less than someone else's perfect dose, and that's okay. I also move the goalpost with these types of patients. I'm not going to push your levels to the same therapeutic goalpost as I would for someone without histamine issues. It's going to be a little bit lower. If you sit around between the 200 and 250 mark, I'm going to be very happy. Whereas my other patients, I want to see them closer to like 300, 400, if we can get them there. And if we can't, anything above 250, I'm happy. But if there's histamine issues, I want you to be as close to 250 as you can get, but I'm okay if you're closer to 200 because we don't want it to be an excess, keeping in mind the genetic component, the DAO, and all of the other things. I see a lot of patients come to me and they say, I took an antihistamine and it fixed the problem. We call these band-aid solutions and symptom managers. Do you want to manage the symptoms or do you want to fix the root cause, right? You want the long-term relief that you're going to get from restoring your gut health, cortisol. We have what's called a diurnal rhythm, which is why I test the morning cortisol and 6 hours later, the afternoon cortisol. You want there to be a 50 to 70% drop. That is a healthy diurnal rhythm. You want to see that. Sometimes it's reversed. You got to work on that. You got to figure out what's going on and tackle that, whether it's herbs or supplements or whatever. Progesterone, key player in that. Um, Another myth is all estrogen therapy behaves the same. It does not, which I've already gone over. We've got your body identical, which is just a fancy speak for the original term of bioidentical. It all is the same thing. It's biologically identical to what your body once produced. That's all it is. It doesn't matter if it's body or bioidentical, it's the compounds that matter. So getting hung up on that, as long as the compounds are what your body made, you're good. The 17B estradiol, the progesterone, that's all that matters. The synthetic ones are going to act very differently in your system. So, how you reacted once upon a time to a birth control pill with conjugated equine estrogens, not going to be the same thing with a 17B beta estradiol. It's going to be a completely different reaction because they're different compounds. Only the bioidentical estradiol supports your brains, your bones, your cardiovascular health, and it doesn't drive the same histamine chaos that estrogen does. So even in patients who had severe reaction to estrogen, the conjugated equine ones, the estradiol doesn't do the same thing. So you can be a little bit less, be aware, but much less afraid. So route matters, dose matters, delivery method matters, and titration schedule. If you understand this, excuse me, and you listen to your body, you're going to be just fine. That's histamine.
Wow, Holly, you just covered everything that's just so interesting. I've had a lot of people be quite surprised that I'm not taking estrogen, estradiol. I mean, I'm using a cream local cream for vaginal dryness and making sure that everything stays squishy and healthy. I was like, people
Yeah.
ask me why. It's like a healthy vagina is a squishy, stretchy vagina. And
Yes.
I don't feel bad about putting moisturizer on my face.
Mm.
Why should I feel bad about using moisturizer that's specifically for those issues to keep the,
Oh, yeah.
I just, it's so much fear that I think really affects people getting the right kind of care. And I really appreciate how you hit on that, the individualization, right? Like
Mhm.
each person is going to be just a little bit different and their
Yeah.
pathway. Now I'm thinking of one of the clients that I have who's having some really big issues. And I'm like, I wonder if we've ever even talked about histamine because I'm thinking that a
Yeah.
lot of her stuff really is that she's in
Yep.
that loop
Yep.
with the histamine
Absolutely.
and then, trying to figure out how to get out of it. And I love that you talked about DAO because I really haven't seen or heard a lot of references to it,
Mhm.
but it would seem to me to be like a key
Oh,
element
yeah.
in addressing it, right?
Yeah.
Instead of just
It's
running for
huge.
an antihistamine.
Yep. And Danny just emailed the other day, who's one of the people over at Zymogen, and he said, "Oh, the Hist DAO is back in stock." And I was like, "I am going to order like 10 bottles because they ran out." And I was like, "Oh,
Uh-oh.
I can't. Oh my
Yeah.
God.
Yeah,
Have to have that."
I had that with the one of I love lion's mane. It's a mushroom and it's been very helpful for
Mhm.
me in the morning and with the cognitive stuff. And I found one that
Mhm.
was really, really good, made by a couple chicks in my town. Love to support local. And it
Yes.
really worked. It was like put it in the coffee and then wow, this is some really good coffee. Wake up.
Mhm.
But they stopped making it. So then I had to switch and find, so then I, go on the
Mhm.
journey again. And I just, my take on it is I just try something. And if it's not working for me, I just keep trying different brands, or maybe there's different ways that they produce like, what's the difference? Maybe the factory is different. Maybe the way they produce it is different. Maybe the way they handle it is different. I have the feeling that those gals really loved what they were doing, making their powders, right? And
That's probably a big part of it.
I think so. When you're putting together, it sounds like that's one of the things that I like about how you're working with women is it sounds like you're doing that when you're doing their plan
Mhm.
of
Yeah.
what we're going to do, right? Putting a lot of love and attention into that individual person to try
Yeah.
and help them to
Yeah.
really strive towards those optimal levels and that, not just getting comfortable or not just getting rid of the symptom.
And things change, right? So, in my area, in Ottawa, I'm in the nation's capital, and in the spring, when the snow starts to melt, we have snow mold. And the amount of people that have no idea what snow mold is, they think I've got a flu. Every spring, I get a flu. You don't have a flu; it's the snow mold. So, I formulated a tincture for myself because I needed to do something for the snow mold. Because histamine, MCAS, snow mold, no, thank you. Like I need to function here, so I have a tincture that I use just for that. And lo and behold, it worked for dog allergies and for cat allergies. So different patients were like, "Hey, I went and saw my sister. I took your tincture. Did you know it works for cats?" Really? It's not supposed to be well, it's an allergy tincture, but that wasn't my goal in mind. It was to try and, mediate some of the, symptoms that I got from the snow mold. But I ended up putting together an entire snow mold protocol for people in my area because word of mouth, right? And it was, here you
Yeah.
go, it's free, just download it. There's like not charging for it, just grab it and here's the things you're going to do, the foods you can eat to support DAO and like the high polyphenol count olive oil, the one that's really peppery or you feel it here. And if it's really high here, you're going to cough like, "Oh, it got me. Oh, that's what is that? It's almost spicy. What's happening?" That's the polyphenols. That's how you know it's got a lot of them. Really green taste to it. That's
Hmm.
the stuff you want. Shoot that back. Pooey. You're gonna know. Your histamine's gonna calm down a little bit. You get your DAO enzymes gonna calm it down. Certain supplements, the B vitamins, the zinc. There's a whole slew of them. They're great for histamine symptoms. If your histamine is high, if you're eating a lot of reheated, like, oh, we had meat, we had hamburger, ground beef, whatever, and then the next day it's in the fridge, you have it. Well, you just increased your histamine load right there.
Mm-hmm. Mm-hmm.
So, how bad are your histamine symptoms? Do you have just histamine issues or do you have mast cell? Like, do you have MCAS? They're two separate things. Do you get hives? Do you get this reaction? Do you get that? So gauging where you're at and acting accordingly is going to help set the terrain for being able to utilize hormone therapy. And because we're all so different, you know, it looks different for you than it might for your perfectly healthy, if that's what you want to say,
Hmm.
girlfriend down the street. Because what she can do, I can't do. I mean, I have MCAS. I take 2.5 milligrams of oral estradiol. That's my dose. I should never have been able to get to that dose, but I did. Slowly, steady. Also, when I come off the GLP-1, even though it's a low dose, I listen to my girls. They'll tell me when
Hmm.
I've had enough. So before my histamine even kicks in and starts to spiral, my hoo-haws right here,
Yeah.
they say, it's too much estradiol and I hurt. Take it back. I didn't want it. So then I
Yeah.
back off my dose. And then I'm okay, 2 milligrams. Still too much. 1.5 milligrams. How do I feel? Does my bra hurt? No? Okay, 1.5 it is. We'll sit there for a bit. And then when I notice absolutely nothing, there's no issues, I'll creep back up again, maybe 1.75, maybe 2,
Yeah.
and I'll sit at 2. But I play with that dose because you can do that. I have my little lupin estradiol and I get it doled out in zero point 0.5, but they're perforated. And because they're perforated, I can cut one in half to a 0.25. So there's fine tuning that you can do as the patient, listening to your body. Maybe someone else's histamine response is going to kick in before their breasts become tender or
Yeah.
sore. And if that's the case, oh, I'm really like sneezy and allergy and whatever. Is it a cold? Or maybe just drop your dose back just a little bit, just by, by zero point 0.5, drop it back, see how you feel. Do that for a couple of days. It's not going to
Hmm.
hurt you. 2 or 3 days of backing off on your dose isn't going to hurt you. It's not going to throw your therapeutic levels in the garbage and you start all over again. You'll be fine. Our body is used to a fluctuation. So going down a little bit for a couple of days is okay.
Hmm. Yeah, that makes a lot of sense. I'm really glad that you talked about the histamine and the anxiety
Oh, it's
because
huge.
yeah, I see that
Mm,
a lot and for myself. And I don't know if I told you, but I got into I started reading up on it, right? Got kind of in I'm get curious about a subject and histamine was like, okay, I don't know what this is. I don't know, right?
yeah.
And so one of the foods that was on the list of possibly creating more histamine for me was avocado. And I was like, I have been eating a half an avocado a day,
Yeah.
for the good fatty oils, and it's good for
Hmm.
you. And so maybe like not, I'm not a big fan of like all or nothing. I don't really feel like I need to like completely cut it out, but I was like, maybe I'll try and see about like twice a week
Hmm.
or maybe 3 times a week and see if it makes a difference. And yeah, it did.
You have a histamine bucket, right?
Yeah.
So you're filling it.
Yeah.
As long as you're not filling it faster than you can empty it, you're okay.
Yeah. Yeah, and
That's it.
that one made sense. And then the other thing was the meat and eating leftovers. I really noticed that too. I was like, that's something that I can actually avoid because I can take what I'm going to eat and I can freeze it and
Yes.
then defrost it and eat it. And
Yeah.
that I think is also helping. And just being a little bit more aware that histamine could be at play, because before
Hmm.
I was really, completely unaware that that was well, it does seem to be maybe a lot more common than we think. Like,
Oh, yeah.
yeah, the two of
It's a lot
my
more.
friends that are really having a lot of perimenopause issues, they're both having more allergies, like asthma attacks and allergies. And I keep saying,
Yeah.
"Have you looked into this histamine?" They're like, "No, whatever, too busy, can't manage to
Yeah.
whatever learn something new." But it does really, it just makes so much sense. So I just love everything that you shared, Holly. It's you know, very reflective of the holistic idea of treating the whole person, which really
Yeah.
everybody so far has said, which is interesting because I didn't actually talk with the people in the panel about that, about how important being holistic is to me. So it's really interesting that everybody did that. Everybody talked about how the systems are intertwined
They
and how, you
are,
know what I
yeah.
mean? And treating the whole
Conventional
person.
medicine, it separates everything, right? You've got your hormone doctor over here, you got your baby doctor over there, you got your foot doctor over there, you got your generalist who doesn't know what's going on anywhere. They're just here for the party and the drinks, the free food. You know, nobody's talking to each other.
Yeah.
We're not the whole body. My cardiologist doesn't talk to my endocrinologist, and the endocrinologist isn't talking to the oncologist. The oncologist isn't talking to, like, what's going on here? Nobody's communicating because I know that they're separate organs, but they're all a part of my body. They're all
Yeah.
communicating, and the hormones are touching every single system. I know that histamine's an issue. So who do I see? My allergist? But they're like, I don't know. Here's a
You don't
this,
have an
that.
allergy. Yeah.
They're, yeah. I'm like,
We
it's
did the
not. It's
test, right? The
histamine,
pokey.
right?
Yeah.
Yeah. Like what do you do? Even MCAS, I'm part of these groups, and there are some really, connective tissue and mast cell and POTS and all these different things that go together, especially since COVID, where there's a lot of crossover and talk, more awareness, and the hormone component comes into play. So it's getting more awareness. And now people go, well, what about the oxalates? Because oxalates are an issue. And that's part of the histamine conversation because there's a little tie in where they kind of go together with the soft tissues. So then what? I mean, it can get really complicated when all you want to do is not have hot flashes and
Yeah.
sneeze anymore. You just want to feel good. You want to
Just want to
sleep
feel
and not have
better.
anxiety.
Yeah. And not be terribly angry or like one of my friends had her antidepressant just suddenly stop working. And I keep saying to her, it's probably partially hormones.
Yeah.
And then, she's like, no, because hormones are like hot flashes and they didn't work for me. But from your presentation, it could be that something else was really out of whack or she was really sensitive. So trying to add like a standard dose was way too much for her and it should have started slower and creeped up. And
Mhm.
yeah, that's one of the things I also appreciate because for myself personally, that's been really important. Like pick a thing and add it in and then do
Yes.
that for a while and see how you feel. And then when you feel like that's easy and that could be anything, right? Taking
Yeah.
medication or doing home cooking
Mhm.
from home or trying to add in some exercise, whatever it is
Mhm.
that you're adding, just do that one thing until that's easy. And then you'll add something else and then you'll add
Yeah.
something else. And from there, you'll end up in 6 months with a completely different situation.
Yep. Absolutely. Tiny things develop the habit. When it's a habit, it's going to stick, and then add something else.
Yeah.
Make that a habit. Yeah.
Yeah. Awesome. Awesome. Okay. So is there anything else you want to cover? I think you covered everything really well.
I think I did everything. I kind of was like, gosh, I haven't talked about histamine in forever. So I was like, I think that's everything. I kind of dug out some old slides and then revamped them because I realized they were from, I don't even know, 2002 or something
Yeah.
ridiculous. They were like,
That's how you know you've been doing it a long time, right? When you pull out like I've been teaching music lessons since 2001 and every so often I'll be like, I think I have a version of that. And sure enough, I do have like just
yeah.
thousands of pieces, but I haven't looked at it in so
Oh
long. And
gosh.
that's just
Yeah.
it's good. It's a good situation to be in. Okay, so
Yeah.
you're okay if people contact you. If people have questions, they can send them to me, I can send them to you, or they can find you. You are in the group, you're in the CPMS group. So
Yes, I'm in the group. Just don't DM me on my private, like my personal Holly Warner. If there's a Holly Warner Health account, you can shoot a DM there, or just book a courtesy call,
yeah,
or shoot me a message in on my Holly Warner Health page. Find me in the group, tag me in a comment, or reach out to you.
yeah,
However,
yeah.
yep,
And then we'll get all the questions answered and
yes,
all the problems fixed.
all of the problems fixed. All right, excellent.
Not all at once, though.
Yeah,
One thing at a time and
yes.
build up slowly. Okay, it's just been lovely having you, Holly. Thank you so much for coming and sharing your wisdom with us today. Really appreciate it.
Thank you.
All right, so I will be in touch and have a great night.
You as well. All right.
Bye.
Bye bye.